Do you have the flu or a cold? And if you have the flu, what kind? Well, you're in luck. Welcome to Health Equals Wellness, to our comprehensive guide on influenza, commonly known as the flu. In this video, we'll cover everything you need to know about this widespread viral infection, from its symptoms to prevention and treatment. Section 1. What is the flu? The flu, or influenza, is a contagious respiratory illness caused by influenza viruses. It primarily affects the nose, throat, and sometimes the lungs, ranging from mild to severe illness. There are 4 types of influenza viruses: A, B, C, and D. Section 2. Role of influenza strains, A, B, C, and D. Influenza A and B cause seasonal epidemics in humans. Influenza A is further divided into subtypes based on 2 proteins on the virus surface and is the only type known to cause pandemics. Influenza C typically causes mild illness and doesn't cause epidemics. Influenza D primarily affects cattle and is not known to cause illness in humans. The flu is generally more severe and comes on more suddenly than a cold. Section 3. Flu symptoms versus common cold symptoms. While flu and cold symptoms can be similar, there are key differences. Key characteristics of the flu include: sudden onset of symptoms may include fever, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, and fatigue. Potential for severe complications, especially in high-risk groups such as the elderly, young children, and those with chronic health conditions. Annual outbreaks typically occur during the fall and winter months. Preventable through annual vaccination, which is the most effective method of protection. Influenza viruses mutate rapidly, making it challenging to develop long-lasting immunity and necessitating annual vaccine updates. While most people recover from the flu without complications, it can lead to hospitalization or death in severe cases. Key characteristics of the flu include: sudden onset of symptoms may include fever, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, and fatigue. Potential for severe complications, especially in high-risk groups such as the elderly, young children, and those with chronic health conditions. Annual outbreaks typically occur during the fall and winter months. Preventable through annual vaccination, which is the most effective method of protection. Influenza viruses mutate rapidly, making it challenging to develop long-lasting immunity and necessitating annual vaccine updates. While most people recover from the flu without complications, it can lead to hospitalization or death in severe cases. The common cold is a viral infection of the upper respiratory tract, primarily caused by rhinoviruses, but it can also be triggered by other viruses, such as coronaviruses and adenoviruses. Cold symptoms usually last for about 7 to 10 days, with the most severe symptoms occurring in the first few days. It is characterized by a variety of symptoms that typically develop gradually and are generally mild compared to the flu. Cold symptoms include gradual onset of symptoms, sneezing, sore throat, cough, usually mild, fatigue, and mild fatigue. Section 4. How does flu spread? People with the flu are most contagious in the first 3 to 4 days after symptoms begin, but can spread the virus even before symptoms appear. The flu spreads primarily through respiratory droplets when infected people cough, sneeze, or talk. These droplets can travel up to about 6 feet and infect others if they enter the mouth or nose. Less commonly, you can contract the flu by touching a surface contaminated with the virus, and then touching your mouth, nose, or eyes. Section 5. Importance of the flu vaccine. Annual flu vaccination is crucial for several reasons. It reduces the risk of flu illness and hospitalization. It can decrease the severity of illness if you do get sick. It helps protect vulnerable populations. It reduces the burden on healthcare systems. While vaccine effectiveness varies year to year, it typically ranges from 40% to 60% when well matched to circulating viruses. Section 6. How to prevent the flu. Prevention is better than cure. Here's how you can reduce your risk. Wash your hands often with soap and water. Practice good hand hygiene. Clean and disinfect frequently touched surfaces. Avoid touching your face. Seriously, we all do it, but it's a big no-no. Boost your immune system with a healthy diet and exercise. And if you're sick, stay home to avoid spreading it to others. Simple, but effective. Section 7. Seasonal flu versus pandemic flu. Seasonal flu and pandemic flu differ in several key aspects. Occurrence. Seasonal flu happens annually, typically peaking between December and February. Virus strain. Seasonal flu is caused by influenza viruses previously circulated in the population. Pandemic flu is rare, occurring only 3 times in the 20th century. Pandemic flu results from a new influenza A virus that is very different from current and recently circulating human seasonal influenza A viruses. Immunity. Most people have some immunity to seasonal flu from previous exposures and vaccinations. For pandemic flu, most people have little or no immunity due to a lack of previous exposure to the virus or similar viruses. Severity and impact. Seasonal flu usually causes minor impact on the general public. Pandemic flu can cause major disruptions, including travel restrictions and school or business closings. For pandemic flu, vaccines may not be available in the early stages and may require 2 doses when developed. Antiviral supplies. Adequate antiviral medications are usually available for seasonal flu. During a pandemic, antiviral supply may not meet demand. Healthcare system impact. Healthcare providers can usually meet public needs during seasonal flu. In a pandemic, healthcare systems may be overwhelmed, requiring alternate care sites. Economic impact. Seasonal flu has a manageable impact on domestic and world economies. Section 8. The global impact of the flu. The 1918 Spanish flu killed millions, reminding us of the flu's potential to devastate populations. Today, healthcare systems and vaccine programs are much better equipped, but the flu still costs lives and billions of dollars every year. Staying informed and prepared is key. Now, you're equipped with the knowledge to outsmart the flu this season. So, get vaccinated, stay healthy, and don't forget to share this video to help others stay protected too. Hit that like button and subscribe for more health tips from Health Equals Wellness that might make all the difference in your life.